Back. I always love to come to this echo. Appreciate you all taking time to chat with me today about involving young family members in care. So, just wanted to touch on a couple areas today of talking about how mental illness impacts younger family members that may or may not be in the home. Considerations if we're thinking about involving younger family members in treatment or in the client's treatment or patient's treatment, and identifying those common needs that kind of cut across ages and also age and developmental specific needs that you typically see in youth who have a loved one experiencing a serious mental health issue. So just some things to get us thinking. I think it's always nice to orient, at the beginning of a talk to see how things might apply. But with the individuals with whom you currently work, how many of those folks have young family members in the home? It may be their children, it might be their siblings. And what do you know about those younger family members and their relationship with the client? The dynamics in the home that involve the younger family members, and have they ever been included into services with the client and the family system in the past? So just some things to kind of get us primed and thinking in that direction. So I always like to start with my thinking systemically statement. And so when you're thinking about young family members, they truly do have an impact on the family system at large and influence over the family system at large, no matter their age, and vice versa. They're impacted as well by that family system, including the individual living with the serious mental health condition. Um, and so, when we're thinking about the potential for involving young family members in treatment in some way, shape, or form, thinking about different factors that impact young family members that have a loved one experiencing a serious mental health condition. So their age and their birth order, the type of relationship they have to the client. So it might be a parent, it might be a sibling. What was their baseline relationship like, and how has that changed since symptoms started for the client? Personality factors, the nature of the symptoms, the course of the illness. We all know that course of serious mental illness is not linear, and it's not predictable. Are they residing in the same home, and what types of external social supports are available to this young person? Now, there are commonalities of needs of young children or youth in the home, regardless of their relationship. However, there are a few differences that I like to bring up because I think they're really important to consider as you're thinking about what it might be like to involve a young person in care. So, anxiety and fear might be greater in young person when the client is the parent, because that person is who that young child depends on for care. When the client is also the parent of this young person, the child is more likely to take on sort of that parental role or parental duties, especially if there are other children in the home, which puts a lot of pressure on them, obviously. And parenting style may be impacted if the parent is the client. So this can impact how a child develops, how they think about the world around them, how they interact with the world around them. And so some pretty substantial things to be thinking about when you're working with an individual with serious mental health conditions who might have involvement with a young person. Some initial things to think about if you're thinking about potentially bringing in a young person into the fold of treatment is the level and degree of involvement that might fit best for this family system at this time. And, food for thought is that obviously if parents or guardians are not on the best of terms, are separated, are divorced, then there's likely to be differences of opinion about how involved they want the young person to be. This even happens with intact families as well. So really taking the time to explore what it might look like, what everybody's understanding is, and what the expectations might be before diving too far into getting the young person involved. If the young family member if they are biological children, if they're step or half siblings, if there's a foster or adoption status, if they're a blended family, so all of these factors that may be impacting the young person's response to an experience of the mental health condition. The young person might be receiving individual services already. There may be children's services involvement and always considering factors related to safety. So, how often, in what ways, to what degree you involve young family members in services will vary by some different factors. First and foremost, it's level of need, and typically there's always a level of need. Dynamics within the system, age and developmental stage, as we mentioned, the client's preferences and level of comfort for involving that young person, as well as the guardian of the young person, their level of comfort and preferences for involvement. So things to have discussions about and be considering in the back of your mind prior to engaging them in treatment. So, there are a serious, it's clearly a complex situation when you're thinking about a young family member in a home. However, I think it's really an excellent opportunity to involve young people because it provides, excuse me, an opportunity where there's open communication, chances for normalization about what that young person is experiencing so they understand that they're not alone, and also destigmatization of mental health issues. Yeah. And it also allows adults to be able to share really important information in an understandable way, and these adults are supported in how they are delivering that information through support and guidance from the practitioner. So, there are some needs that are pretty common regardless of life stage or age. We want to ensure that we're providing developmentally appropriate information so that it's understandable and not overwhelming to the young person. Common needs for all young people are, support for their normative development. So are they feeling safe at home? Are their physical and emotional needs being met? What is their engagement in the educational system like? And has that and, fun and opportunities for opportunities for individuation and autonomy, have those been impacted by having a loved one in the home with a serious mental health condition? All young people really benefit from a listening, non-reactive, non-judgmental ear because that's not something that may be available to them, especially if there is a loved one in the home in the throes of, say, a psychosis. They're looking for honesty. They benefit from lots of reassurance and from a sense of normalcy. So encouraging these families to find opportunities to celebrate one another, to engage in activities together, just so that things aren't always so heavy. They also have needs and feeling as though they're able to set limits and boundaries for what makes them feel safe and comfortable. If there's a history of trauma, oftentimes that's shared trauma amongst family systems. And so processing what that experience was like after it has occurred. They often want to know, when will my loved one be better? And they need reassurance that they're not alone in this. So, that was sort of bigger picture that cuts across all ages and developmental stages. And so I wanted to take just a couple minutes to hone in on some highlights for each of, these blocks of developmental appropriate information and how to share that. So if you're thinking about infants and toddlers, there's limited information that they might need or that they might understand verbally, but they do require attention and a lot of support and feelings of stability and safety and comfort. And sometimes those things aren't always naturally occurring if there is a heightened sense of chaos in the home due to mental health issues. So, if there is a new baby brought into the home, it's a significant transition for everyone, including the individual with the mental health condition. And so thinking about how noise level, which we all know babies are noisy. And so how is that impacting the person with the serious mental health condition? The level of stress on parents when a new baby is home, especially if one of the parents is the individual, is the patient or the client. What attention is going to the other children in the home when there's a new baby, especially if one of those other children is the patient. And we know that the crying and the noise level of infants and toddlers really can increase that level of stress. And we know for individuals with serious mental health conditions, the goal is to keep the home environment as calm and stable as possible. And so this kind of rocks the boat a bit. And also, this is for very young children. Even though they might not verbally understand what's going on, they can sense that feeling of stress. They can sense when their feelings of emotional needs aren't being met. So things to think about with little ones. So for preschoolers, when you're thinking about involving them in treatment, and this could apply to mental health or, any kind of physical health condition as well. So if you're, not necessarily working with a family directly in the mental health world, but preschoolers typically need fewer details and less information. They need simple explanations that use simple words and as few words as possible. And oftentimes they really do better in understanding and response if things are brought to them as a story or there are pictures to make it visual or things to make it interactive because they are very visual creatures and so they focus on the things they can see. But at this young age, if there is a feeling of instability, they will need and benefit from a great deal of reassurance that things are okay, parents are here, you are safe. On the other hand, when you get into kids that are a little bit older, so for example, like elementary school age kids, they're a bit better in expressing their feelings most of the time. They likely want more specifics and more detailed explanations, and they're going to ask a lot of questions about what's going on with their loved one, especially if there are odd behaviors or things that have happened that are scary. They will have concerns about their safety and the safety of people that are around them. Um, but these questions and concerns are pretty straightforward. And so it's, is so and so going to die? Am I going to be injured today? So really in response, our answers or our replies or the parents' replies, guardians should be really direct and straightforward, simple and honest. Providing practical information about the illness and what to expect, but in a way that they will understand. Again, keeping it brief but being clear. They also need reassurance because they're going to have many concerns, and they're also going to need validation for these feelings when they're able to identify and express. And sometimes it's going to be helping them to identify what that feeling is. So if it's coming out as anger and acting out, is it because they're feeling, afraid or neglected, or what's that feeling underneath? And so shorter discussions, brief little talks with the child over time will fare better for a young person than a longer sit down, family discussion would. As we get older, thinking about teenagers and their needs, obviously they can handle typically more detailed information, and they're going to be asking more difficult questions, very specific questions about what's happening. And they also tend to talk when they're ready. So no one, we've all been teenagers. Many people, many of us have teenagers or had teenagers. So, it's on their time. It's on their schedule. And so talking and being there and when the opportunity arises that they're ready to have a chat. Fortunately or unfortunately, they already have some information about mental illness that they've received, probably flooding at this point from friends and social media and other forms of media. And so, really having a firm understanding of what they know or what they think they know so that we can identify how much is misinformation. They respond best when it's very much a kind of an open-ended conversation, and where there's a lot of opportunity for back and forth. They will at times, if you keep it, simple, brief, transitional age youth specific, they will benefit from literature if they're able to read it on their own time. So providing them with links to videos or to information. And also, again, being honest with what's happening with their loved one. And if they have someone in their life, somebody for, a spiritual leader, a coach, their best friend's dad, somebody that they really feel comfortable with, and that is a place of safety and support and stability for them, it's okay to encourage them to talk with that person about it, about their own experience. So you see a lot of different responses from young people when one of their loved ones has a serious mental health condition. So you might see sort of this acting out, getting in trouble, angry behavior, and that anger may be directed inward, so they're seeming depressed, or outward, where they're getting in trouble at school. Anger can be pointed in all different directions, oftentimes towards parents and siblings, people in the home. But health professionals can also be on the receiving end, as can teachers. Um, there are feelings of hurt, envy, resentment, frustration about what's occurring in their world. Oftentimes, there will be a sense of, especially for older children, this sense of loss and sorrow and grief because they have an understanding of how things were and they have this fear about how things will be. If you have a child who, if it's a sibling with a mental health condition and they do not experience any kind of mental health symptoms themselves, oftentimes there's this level of guilt or survivor's guilt, that, why is my brother sick and I'm not? Feelings of shame, sadness, denial, confusion, embarrassment, and that all ties very closely, obviously, into the stigma surrounding mental health. And there also is a lot of fear and a lot of worry, not only for themselves, and not only for their loved one with the illness, but also for the rest of the family and also for their own future and for their loved one's future. Oftentimes, if there is a sibling with a mental health condition, kids will feel like they have to be the well child, so that they're not, increasing tension in the home. They're not being a bother to parents. Parents have enough to worry about. I don't want to cause any waves. And so that comes with a lot of pressure. They also take on this role of parents, or you see them acting older than their age, and feeling like they need to be there to support everybody else, but they're not really processing their own experiences. And obviously, stress responses where you'll see, loss of appetite, social withdrawal, sleep and concentration difficulties, crying, et cetera, et cetera. And so I just wanted to highlight a couple of areas. So, if that are most common. So this idea of fear and worry about their loved one with a mental health condition. So especially if it's a sibling. And that seems to be where there's a lot of fear that, is this going to happen to me? Did I cause this? So reassurance that it is not contagious. Talking to them about, yes, there is a hereditary component to illness, and so there is a risk, but that does not equate to their fate will be the same as that of their sibling. And so, being related, or if it's your parent, being related does not mean that you will develop psychosis, or a serious mental health condition. Encouraging them that just them talking with you about it is a step in the right direction, and it will help, keeping a watchful eye on how they're doing, encouraging them to be open about their experiences, and if anything, if they ever have any kind of odd experiences, and that it's not just one factor that leads to psychosis or another mental health condition. The other thing that happens often is self-blame. So young family members blame themselves, thinking that they did something to make this happen, especially if it's to their parents, if their parent is the one with the mental health condition. So reassurance that they didn't cause the illness, they are not responsible for causing the illness, but they're also not responsible for that individual or the family's wellness. But there are things that they can do to be supportive and maintain a supportive environment. Um, a lot of times kids will think, well, if I just behave, if I just do better, if I get better grades, things will get better. That will be the cure for my mom. And when it's not the cure, there's a lot of frustration and anger and disappointment because it's failed expectations. And then just a constant reminder that, mental illness is no one's fault. It's a no-fault disease. So just some things to think about as you move forward in your work. What is your role, if any, in involving young family members in care and the various types of care that you provide? And thinking about, your current role and what you currently do with involving young family members, and is there opportunity to find other ways to do it more often, or to open the doors a bit for those kinds of discussions, or importantly, to provide guidance for the guardians or the adults or the parents in the home for how they can talk with the children based on their age and developmental stage. And so even if you're not directly seeing the young person, but that young person is being impacted, and that having a young person in the home is stressful for your patient. There are opportunities to work with the patient about how to have these kinds of conversations or to point them into the right direction for resources. Well, I've included some of my favorite resources. Cope Me and ISA are a couple of my favorites. But, so feel free. These are great things to pass forward to adults in the home so that they can figure out and you can work together about what to share with the young people. So thank you all so much for chatting with me, and I'm happy to take any questions or, start a discussion if there's time about, how this comes up in your practice or in your world.